What are the kind of useful health services that emerged for sex workers post-decrim?
The sexual health professionals come in and work inside that clinic, and they have a sex worker focus because we tell them what we need. So we say, don't talk to us about how to put on a condom. We probably know that. There are other issues that, are really important, and it depends on the sex worker. So it's tailor-made to whatever that particular sex worker would need. So, for example, you might have a sex worker who says, look, I'm not happy. I'm working 12-hour shifts. I'm exhausted. And so she might say that to the nurse, and the nurse might say, well, look, that doesn't sound good to me. It doesn't sound like you're being respected in the workplace. You should talk to one of the peers outside the little clinic room, and they'll tell you about your labour rights. The nurse might be able to tell the sex worker about particular things that we're not expert on. So a sex worker might say, look, I'm worried. I'm really worried about mpox. How will that affect me? And so, that kind of relationship is tailor-made to each sex worker.
Are there any remaining challenges that you still experience 20 years after decrim?
We haven't got full decriminalisation. We'd like to see anti-discrimination legislation. There are still discriminatory things that can occur. People can discriminate against sex workers. So they can say things like, well, we're not going to lease you a space to live in because you're a sex worker. So we'd like anti-discrimination legislation. We have a really hideous piece in the legislation that's anti-migrant, and that was done on the back of lobbyists who were concerned about trafficking, and for some reason there was this idea with the politicians that if migrants were prohibited from working in our country as sex workers, that would prevent trafficking. So we have to overturn that. That's been quite a concern, a major concern for us, actually, because we have a pocket of sex workers who arrive and are able to work in any other occupation bar sex work, but they do sometimes work as sex workers and they don't have the same protections.